So what brings you in to see us today?
I've been feeling down the last couple of weeks. Can't really get a hold of it. Not sure what's bringing it on.
Just sort of. How are you sleeping?
I'm sleeping good. Feeling a little lethargic. Just depressed.
Anything else going on? Any chest pain, palpitations, shortness of breath?
No change in medical.
Bowels working all right?
Yeah.
And now tell me about drinking. Tell me about any alcohol.
I used to drink about a glass of wine a night, maybe a little more on the weekends if we were out to dinner. But now I'm not really drinking anymore. It makes me feel tired.
Yeah.
Kind of cut that out.
Okay. Well, I'm going to do an exam here in just a moment, but when folks have the kind of symptoms that you're describing to me, or the complaints, a lot of times it's a problem with how we're dealing with life, and there's different ways to approach that. You can use certain medications. Basically, there's like a neurochemical thing going on in your brain, and it's usually the result of things that are going on around you. But there's ways to approach it with medication sometimes with therapy with a psychologist. But I have a colleague that I'd like to have come in and talk with you if he's available. I'll go see if he is. And if he is, I'd like for him to just sit and talk with you a little bit, maybe understand this a little bit better. Is it anxiety? Is it depression? Is it a mixture of the two? And then he and I will put our heads together and formulate a plan to develop a way to address this. And then, of course, you'll be getting back a hold of us maybe in 3 or 4 weeks, and we'll see how things are going.
Okay.
But I'm going to go ahead and see if he's out there now.
Thank you.
All right.
Yes, sir.
How you doing?
Hey,
I'm Dr. Corso.
nice to meet you.
Mr. Golden?
Yes, sir.
Okay. Dr. told me that he's going to go run and see his next patient quickly, and he said that he wanted us to have a quick chat about some symptoms you're having. Do you have a little time to hang out?
Sure.
Okay.
Sure, if you can help me.
Sure. Before we begin, let me just tell you a little bit about who I am and what I do. Everything I'm going to say is on this piece of paper, so if you have any questions later, just feel free to refer to that.
Okay. Thank you.
You're welcome. I'm a behavioral health consultant for the clinic, and I'm also a clinical health psychologist by training. And so what that means is I work with your primary care provider in situations where taking care of your health involves more than just physical factors. So anytime habits, emotions, thoughts, behaviors, or any interaction of those impact your health, I get called in to help target that one part of your care. Okay?
Sure.
In order to do that, I'm going to take about 15, 20 minutes and ask you several questions about what's going on, and then together you and I are going to go ahead and make a plan that seems doable for you.
Cool.
Right? That plan may include reading some materials. It may include working on some very specific skills on your own. If you're developing some momentum with those skills, we may have you come back for 1 or 2 quick follow-ups. If you and I think you'd be better helped by a referral to a specialist, I can also help facilitate that for you.
Okay.
And at the end of this appointment, during the appointment, I'll be documenting what we talk about in your medical records so that Dr. Parker or any other member of the healthcare team can understand what's going on with your symptoms and how they can assist you.
Thank you.
Okay. And also, just like any other medical appointment, there are some limits to confidentiality. If it appears that there's an imminent risk of you harming yourself or someone else, then I would have to get other people involved to help us make the best decisions to keep everybody safe. If you share with me that there's any abuse that's going on in your family, I may have to act on that information as well to help keep everybody safe.
Okay.
Any questions about the limits of confidentiality?
No, sir.
Okay. All right. Well, Dr. You said you might be having some symptoms of depression. Is that what you wanted to talk about today?
Yeah, I think it's depression. I just I feel like I've been sleeping okay. I told Doc I used to drink about a glass of wine a night, and I haven't really kind of cut that out. That's still making me feel a little even more lethargic.
Okay. One glass, how big? They make those wine glasses.
Well, we just take the cork out and put a straw, and that's one glass in my house. But no, a normal glass.
Okay, normal size.
Yeah.
Okay. But 5 ounces maybe.
5, 8 ounces, sure.
Okay. Okay. All right. Let me back up a minute. When did your symptoms begin?
About 2 months.
Okay. And what was going on in life at that time?
Normal. Kids are school, wife's working. We hired some new people at work, so I've been training them. I've been taking some extra time at work, and then sometimes a little bit more once I get home. If I fall behind.
How many hours do you find you're working a day?
I probably put about 10 in at the office, and then if I have to come home and bang around for another hour or so, maybe.
Okay. Is that a typical amount of workload for you, or is that different than?
It's a little different than usual because I'm making up for some of the new guys' work. Trying to keep everything moving smooth. So eventually it'll fall back into their laps, but for now, they're counting on me to get it done.
So it sounds like you have more work than typical.
Sure.
Okay. And when did that start?
About 3 months ago, we hired her.
Okay. Okay. All right. So it sounds like about 3 months ago, you had some changes at work that have increased how much work you're doing. It sounds like you're also bringing some work home and doing it at night. But otherwise, things at home are okay. How's your relationship with your wife?
Wife's good. We haven't been intimate that much often. I've been kind of tired and just kind of not really into it.
Okay.
I gotta imagine it's going to affect her. I haven't heard anything yet, but other than that, we're okay.
Okay. And your relationship with your kids? How's that going?
Good.
Okay.
Kids are okay.
Are you in any physical pain today?
No. That's one of the reasons why I wanted to see Dr. Parker, because I don't have any physical ailments. It seems to be more emotional.
Okay. And you mentioned sleep. Are you having troubles falling asleep or staying asleep?
No, I might wake up once in the middle of the night, but it's just rolling over and going back to bed is fine.
Okay. Are you noticing that you're rested in the morning when you wake up?
I still feel tired. Even if I sleep extra, I still feel a little tired.
Okay. How long has that been going on for?
About the same, I guess, not 2 months.
Okay.
Yeah.
Okay. How's your concentration?
I've been forgetting some things lately, things that I don't usually forget.
Like misplacing your keys, things like that?
Yeah, handing reports in, even though they're done for work, just things that just have slipped my mind. I'm not sure really why. Maybe this ties into it.
Okay. And how's your appetite been lately?
Appetite's been okay. But it's weird. I feel like I'm putting weight on, so I don't know if I'm eating the wrong things or if maybe I'm not noticing I'm eating more, but I feel okay.
Okay. We can check the nurse's record that when she checked you and she weighed you and took your vitals, did she tell you how much you weighed?
No.
Okay. Well, we can check with her and see if it's a unhealthy amount of weight.
Okay.
Are you noticing you're less interested in doing the things that you typically enjoy, or that when you do them you get less pleasure out of them?
It's just feeling lethargic about it. So I'm doing them. I'm going through the motions, but I just feel a little. Just everything feels slow.
Okay. Is this affecting you at work? I mean, is your boss telling you that your work is not up to par, or you're not hitting deadlines? Or?
No, I'm hitting the deadlines. I think that's where I'm putting a lot of the effort into to make sure that keeps flowing, especially making up for the new people. Once hopefully they can get their own systems in place, that might work a little back off. But for right now, it's been a little intense.
Okay. And are you noticing that this affects you physically? For example, do you do any regular exercise?
I mean, I've been taking ibuprofen, and that's just for normal aches and pains. Nothing crazy. Unfortunately, I don't exercise. Don't let Dr. Parker know.
Well, everything we talk about, I will share with him, but I won't make it sound bad. I'll couch it. So it sounds like you're not exercising. Was there a time where you did exercise?
I would. When I was younger, we had more time. Wife, 3 kids, full time. squeeze out time to go exercise sometimes is sparse.
So it's been a while.
Sure.
Okay. And how's your overall energy? It sounds like lower.
Even with a good night's sleep, I'm just can't. It's hard to get going.
Are you feeling any guilt about anything?
No, I don't think so.
Okay. How about physically? Do you feel like you're sort of agitated, or the opposite of that, where you're real slow moving?
No, if I drink a lot of coffee, I think I get a little more jittery.
Okay.
Sometimes I'm supplementing that to try and get me moving.
About how much coffee are you drinking a day?
I used to drink about a cup. I could probably get, sometimes 3 or 4 cups in me now. I think I've been trying to maybe push myself.
Okay, so over the last 2 months, how much coffee a day?
I've probably increased at least 2 cups a day
2 cups
on
a
average.
day. Okay. All right. Okay. Are you taking any vitamin supplements, dietary supplements, herbals, over the counter, other than the ibuprofen?
Yeah, no, I started trying to take like a men's daily vitamin.
Okay. Okay.
I don't always remember it, but I try to take that.
Okay. Any other drugs of any kind that are?
No medications, nothing, no prescriptions.
Okay. Okay. How about illicit drugs or substances?
No, sorry.
Okay. And do you smoke?
No.
Okay. Or do you use tobacco? Any chew?
No, nothing. No. Yes.
Let me take about 1 minute and summarize what we've talked about, and you tell me if we missed anything or if I'm understanding it correctly.
Sure.
Okay. It sounds like about 3 months ago, some changes happened at work where you had more work put on your plate.
Mm-hmm.
Okay. And that's also led to you bringing work home as well. And then about 2 months ago, you started feeling kind of down, depressed. You notice that you're fairly tired during the day. It doesn't really affect your work performance. You're still performing okay, but you do notice that you're kind of forgetful. Something I didn't ask is, does it ever get so bad that you think about killing yourself or ending your life?
No.
Okay. Have you ever had a prior suicide attempt?
No.
Okay. Does it ever get so bad that you think about killing someone else?
No.
Okay. So it never gets that bad, but it certainly is bothersome.
Sure, I'm off. I know I'm off.
You know you're off.
Sure,
right?
I am.
Your boss may not notice it, but you know.
Yeah.
And then also, it may be impacting your relationship with your wife. You mentioned not really being interested in being intimate with her, and although she hasn't complained about it, you're aware that something has changed in your relationship. Mm-hmm. Okay. Is there anything I'm missing? Does that sort of capture it?
Yeah, no, it kind of feels like where I'm at.
Okay. All right. I think you have a situational depression, and what that means is that if work didn't become so burdensome and so busy, you'd probably be feeling the way you normally feel. What do you think about that idea? Do you think?
I think that's definitely where it started, but I would think other people get busy at work. Does everyone always wind up depressed like me?
No, not necessarily. I mean, what can start the symptoms is not necessarily what can maintain the symptoms. So how we react to these situations, how we react to the situations directly impacts if the symptoms get better or worse. And sometimes we have a circumstance where there's nothing we can do about the situation. We just have to keep going through it. But how we cope with it determines the outcome. Okay? So again, what you have, I think, is a fairly mild depression, and it's situational, which means if work changed and went back to the way it used to be, you would also go back to the way you used to be.
Fair enough.
Okay? Mm-hmm. And so what I'd like to talk to you about today is just to educate you for a few minutes about depression. I think, here it is. This is a handout on depression. Would you be willing to read it?
Sure, I'll go through it.
Okay, there's quite a bit of information there, but I'm going to hit the high points with you right now. And remember, before I said we'd make a plan on how to approach this?
Sure.
I'm going to write that plan down here for you to take it with you. Okay, so the first thing I'm going to write is read handout on depression. Okay? What do you know about depression?
Your mood alters. You feel, hopefully, what I'm feeling, a little lethargic, a little disconnected. You know, maybe some people may take it a little more extreme, but maybe, you know, I don't feel, like you said, like killing myself or anybody else. I don't feel like that's necessary. But I do want to get back to what I'm used to.
Sure.
You know,
sure.
and I know that I'm not right
At the top of your game.
Yeah.
Yeah. Okay. And so, do you know how common depression is?
Mm-hmm.
About 1 in 5 people can get clinical depression, but there's a larger percentage that get some depressive symptoms or some situational depression. So it's actually fairly common. And what we know is that when we're feeling down or depressed, we do less. And when we do less, how do you think that makes us feel? Or how does it make you feel when you're down? Yeah. Yeah, so we feel down, so we do less. And when we do less, we feel worse. And so they call that the downward spiral of depression. Okay? And what the research tells us is that when we force ourselves to increase our activities, those things we typically enjoy doing, that at first it may just feel like a chore, but eventually the pleasure comes back. We begin to enjoy life again. And so there are a few things that can help depression. The research says that medication can be helpful. The research says that doing more activities that either give you a sense of pleasure or a sense of mastery, accomplishment, productivity, that can help. Medication. Did I say medication? I did. That's what I said at first. Exercise can help. So increasing physical activity has been shown in research to boost mood, while also boosting energy as well. You did mention that you're feeling kind of low throughout the day. So I just want you to have sort of some options here. Something else is increasing social activities and making sure you're staying connected to the people in your life who are important to you. And then something else that can help is engaging your spirituality. Are you a spiritual person?
Sure.
Okay. So have you been in touch with your spirituality as much as normal for you?
Yeah.
Okay. So there are times where people stop doing that or haven't done that in a while, and that can be helpful. And then lastly, there are times where when we're feeling down, our thoughts are kind of negative, and so if I've had a bad day or I'm feeling really tired and worn out, I might think something like, I just can't do it, or wow, this is horrible, I've had a horrible day, or my performance just stinks, or whatever those thoughts are. And what we know is that when our mood is negative, our thoughts are negative. So the other way we can approach this is to start examining some of your thoughts and thought patterns and try to see if there's any way we can improve those. Okay. So of those 6 items, which sounds the most doable for you that you could start doing when you walk out of this office today?
Definitely exercise.
You definitely exercise. Okay.
Sure.
What would you like to do? If you're not, it sounds like you're not exercising at all right now, so we kind of want to set a reasonable goal. Do you want to try 2 days a week, 3 days a week? What sounds doable?
I could probably try 2 days a week to get back into it.
Okay, and what are you going to do 2 days a week?
I'll just use the gym membership, so maybe the treadmill and, if I run a little, do a bike a little or something just to get them cardio. Okay,
so of those options, which one sounds good? Which can we put down today in your plan and say, yep, that's what I'm going to do?
I would use a treadmill. I can do that.
For how long?
I can see where I'm at. I would hope I can still run for at least a half hour.
Okay. And which days this week are you going to do that?
I'd have to do it on Sundays and probably Thursday.
Okay. So 30 minutes on the treadmill on Sunday and Thursday. And what time of day? Do you have a sense?
Sunday would be in the morning.
Okay.
And then Thursday would have to be after I get home from the office.
Okay. So. Okay. All right. On a scale of 1 to 10, 10 being the most confident you've ever been about anything, 1 being a little bit confident, how confident are you that you'll be able to do that exercise?
Probably a solid 6.
Okay. Why is it as high as a 6? Why isn't it a 1 or a 2?
Because I know I can do it. I just once I start doing it, like you said, maybe if I start getting everything moving, I'll feel better and I'll want to.
Okay.
Maybe my pants won't be as tight or my shirt won't be as tight.
Okay.
If I start seeing a positive feedback, or it might encourage me to keep going.
And why is, you said it's a 6, why isn't it a 7 or an 8 or a 9?
I think I haven't done it yet. So maybe once I do it, next time we see her, if I see Dr. Parker again, maybe I'll be at a 9. But I don't want to tell you I'm a 9 and be a 2.
Right, absolutely. Well, and I appreciate that, because the more we can anticipate and estimate how likely we are to do this now, the more likely we are to be able to understand the outcome. So, what would move you from a 6 to, let's say, a 7 or 8? Are there any obstacles or barriers?
No, it's just having not. It's easier not to do it.
It's easier not.
So having that been the excuse, I guess, is just putting me at a 6. But if I'm, Dr. Parker's kicking me in the butt and you're giving me some good information, if it makes me want to do it and I can say I'll feel better, then I want to give it a try.
So let's work with that for a second, because if we can move that higher than a 6, research shows you're actually more likely to do it. So why bother doing it? What's the benefit to exercising?
Well, I don't like the way I feel. I know I'm feeling off. So if exercise out of that list that you gave me is going to start to make me feel better, that's probably the simplest to start with.
Okay. And what sort of what positive impact will doing that exercise have on your professional life?
I'm not sure how it'll affect my professional life until I do it, but maybe just the mind will be a little fresher. The forgetfulness maybe will fall off.
Okay. How about at home in your family with your kids and your wife? How will that increased mood help?
Well, I would hopefully put me in the mood to maybe be intimate with my wife. That's been something that's it's been a problem for us. She doesn't see the problem, but I know it's a problem. So once I start doing it, maybe I'd be able to give you some more answers. So I'm interested to try.
You feel like I'm pushing on you?
No, I just don't have the answers until I do it.
Right, absolutely. You know yourself best, right? You know yourself far better than I do. Given all those benefits to doing it, is your confidence still a 6?
Yeah. Until I can, kick myself in the butt and do it, I feel I'm a solid 6. Once I start reaping some of the benefits of it, and the next time we talk, I'm probably more of a 8 or 9.
Okay.
Hopefully I'll be doing it.
Sure.
By that time it'll be a couple weeks, so I should have a couple sessions.
Okay.
And I think if I see myself liking it, I might add a day.
So that it's going to be the feedback you get from doing it that really motivates you even more.
Sure.
Okay. Great.
And if I'm feeling better, that's even more motivation.
Okay. So if I, thanks for letting me dig into this. I'm going to dig in one more time.
Sure.
If I said that I had $1 million and you completing this, if you completed this exercise, these 2 days for 30 minutes on the treadmill, Sunday and Thursday, that I'd give you $1 million, would you be more confident that you could do this?
I would still need to do it. That's what I'm telling you. I still have to physically do it. You're not going to put me on the treadmill. You're not going to push me.
Right.
So it's myself that has to say whether there's $1 million at the end or there's feeling better at the end. I'm the one that needs to do it. So I don't want to give you an answer.
Right. No. And maybe I'm misconstruing something. I'm asking more about your confidence.
I'm confident that I can do it. I've ran miles. I've ran marathons younger in my life. I know I can run.
So in terms of envisioning getting out the door to do this on a scale of 1 to 10, if 10 is the most confident you've ever been about anything, how confident are you that you'll do it? And does that change if I say, I'll give you $1 million if you do it? Does your confidence change?
No, because I'm still worried about, I've gone this long without doing it. So I'm still worried about, maybe I get out of the car and I'm in a funk and I'm like, I'm not going to do it today.
Okay. That's very helpful. That's very helpful. So
I'll do it tomorrow.
So you're worried that you'll kind of slip back into the old sort of mental state or the state of mind where you say, I can do it later, or I don't feel like it. Okay. So what can we do? Let's imagine that happens. and you're sitting there, you're leaving work, and you say that to yourself. What can we do differently? What can you say to yourself? Have you ever played a sport?
Sure.
Or a musical instrument? Okay. What did you play?
Soccer.
Soccer. Okay. Did you ever find that during a soccer game you would kind of talk to yourself up here or coach yourself through something that was difficult?
Yeah.
Yeah. So you kind of know that sort of coaching voice that you use. Okay. So using that, when you're leaving work, if you have that thought that, oh, I just don't feel like doing this, I'm just going to go home. What can you do to overcome it? What can you use up here to overcome it?
Probably start to envision some of the things that I know that'll be better if I feel better.
Okay.
So,
do you mind if I write this down on our plan? Sure. I'm going to say, if having doubtful thoughts, okay, about exercise, I will envision the positive results that will occur if I do exercise.
fair enough.
Right?
Mm-hmm.
Do you think that'll help?
Mm-hmm.
Okay. Is that something different than you've normally done?
Yeah, because I haven't been doing anything. So.
I'm sorry. Is the coaching yourself different than what you've normally done?
No, I've coached myself through some things, but I've never had to really. I've never really felt like this, so this is new for me.
Okay, good. So this is a little bit of new territory. You haven't had to coach yourself through a time where you were feeling down. Typically, what would happen is you'd have the thought, I just don't feel like doing it, or I'm not going to do it, and so you wouldn't do it. Right. Okay. Let me just write that one in there. And then any other of the things we talked about that sound like they'd be doable for you very easily?
Taking medication is obviously easy, but I don't take any. I really haven't taken any.
Right. Well, you did mention ibuprofen.
Ibuprofen, but I prescribe medicine. I don't know if there's a fancy new medication for something like this. But
there are a few antidepressant medications out there. Research does show that a combination of some of the things we've been talking about plus medication can be more effective than just medication. So if you want, I can talk to Dr. Parker about that and see if he's got some ideas. Typically, the first line of medications for depression are the SSRIs, the selective serotonin reuptake inhibitors. And what that does is helps to keep some of those neurochemicals in your system longer so that they're not sort of taken up and processed. Essentially what it means is it gives you a boost, okay? And there are some side effects to these medications. Some people notice dry mouth, some people get a little jittery, or they sweat. Sometimes people have a little stomach upset. There are times where it can lead to some sexual problems or sexual dysfunction. With all of these side effects, typically they're present initially during the first several days, and then they subside. And so when we do take them, we have to be aware, or if Dr. Parker does prescribe them, just be aware that if you can tolerate the side effects and work through them initially, that eventually they'll go away and you'll start getting the positive benefits. There are some medications for depression where it does give us a little bit of a boost of energy, where we do feel a little more with it, so to speak. Okay? So it sounds like you are interested in that, right? So
just so you know, I would like to go the non-medicated route.
Okay, you want to start?
But if for whatever reason I can't go that way.
It's up to you. What we're talking about is there are several tools in our toolbox. We can use, and medication is one of them. We can use 3 tools at once or 2 tools at once. It's entirely up to you. How do you want to proceed?
I mean, I don't really like to take prescribed medicine. So, I just feel that that's an easy fix because you eat the pill and hopefully you feel better.
Okay. So it sounds like right now you don't want to start with medication.
I don't want to start with it, but I would try to maybe go the other route.
Okay. Keep it as an option.
Yeah.
Okay.
But as an option's fine.
Okay. And then one other thing is that idea of increasing the things that are pleasurable for you or that give you a sense of productivity, mastery, accomplishment. Do you think that that's something that's doable for you, even if it's just 15 minutes a day of reading, if you like to read, or 15 minutes a day of, I don't know if you like to do home improvement projects. Is that a doable goal at this point?
Yeah, I mean, I've fallen off with some of that stuff. I have a workshop where I like to do some things. So, I mean,
okay. So what's a doable goal? Is it kind of tinkering in your workshop for 15 minutes every day, 1 hour a week? What's
yeah, I mean, it'd probably be hard to get in there every day, but maybe over the course of a week, if I could get maybe an hour's worth of time in there, it would be nice.
And if we can identify some likely times that you can do that right now, research shows you're more likely to get it done.
Sure.
So what are some times this week where you might be able to spend some time in there?
Usually Saturday mornings are pretty slow.
Okay.
And there's no activities on Wednesdays, so maybe Wednesday nights.
And I'm going to go back to that confidence stuff again. On a scale of 1 to 10, 10 being the most confident you've ever been about anything, and 1 being a little confident, how confident are you that you'll be able to get that done?
Probably a good 6 or 7 still. I mean,
about the same.
Yeah, about the same.
Okay.
Because I need to get into my pattern.
Sure.
Right now, my pattern is, and it's taking up time, just getting up, going to work, coming home, finishing work, going to bed. Until I can start infusing some of these things into my normal every day, I really don't want to.
Absolutely. Of course. No. And do you suspect that if we use that solution that you mentioned before, that if you're having doubtful thoughts, you'll coach yourself through it?
Yeah.
Can you use that for that too?
I think so. Yeah.
Great. Perfect. So generally, how this works is we give you a few weeks to work on these goals, and then we come back, and you'll come back here, and we'll just have a 10-minute follow-up and just check in, talk about some of the symptoms and make sure we understand if they're going better, going worse, things like that. Do you need 2 weeks to do this, 3 weeks? When would you like to come back?
3 weeks.
3 weeks, okay. Something I forgot to give you at the beginning of the appointment was a questionnaire. This is just it's called a PHQ-9, and it's just a quick depression screen. It helps us understand the severity of your symptoms. Would you take a moment and fill it out while we're sitting here?
Sure.
And then I'll just take a look at it. Thank you.
Just these 15 questions here?
No, they're 9. The ones on this side you don't have to fill out, just the 9 that are on this side.
Gotcha. I think that's all okay.
Let's see. Okay, it looks like you scored about a 12 on this, and all that means is that you're in the mild to maybe moderate range in terms of severity. I think, does that sound about how we've been talking about? Does that sound accurate? Okay. Now take a look at this for a moment, and this is our plan. Tell me if this is what we discussed, or if you want to change it at all, or if this is good.
That's everything.
Do you have any other questions for me today, or anything else I can do?
No, not at the moment.
Okay.
This is mine?
Yep, that's yours. Take that with you.
Okay.
This is the handout on depression, and this is the handout on just this service. And actually, no, this is the handout on the service and what we do here.
Okay.
So any other questions or anything I can do for you today?
No, thank you, Dr. Corso.
You bet. I'm going to have Dr. Parker come back in and just finish up with you.
Okay.
He should be done seeing his other patients.
Thank you.
Okay, thanks. Take care.
Yes, sir.